The COVID-19 pandemic made it harder to get healthcare. There were a lot of reasons for this, but new ways for people to see or talk to a healthcare provider were needed. One of the things done to help was allowing telephone and video-based calls between patients and healthcare providers. North Carolina Medicaid made a lot of healthcare services available over phone or video-based calls so that people could get the care they needed during the COVID-19 pandemic. Having an appointment with the healthcare provider by telephone or by video can also be called telehealth. These telehealth appointments can be over a computer, smartphone, cell phone, or tablet, and they're needed when the healthcare provider is in one location and the patient is in another. At the Duke-Margolis Center for Health Policy, we wanted to learn how people with Medicaid insurance were using these telephone and video-based calls to talk with their healthcare providers, and if some people had a harder time getting the healthcare they needed than others during the COVID-19 pandemic. So what did we find? From our research, we know that not everyone has been able to use telehealth to talk with their healthcare providers. There's still a lot of differences in how people use telehealth across communities in North Carolina, especially for Black, Hispanic, and multiracial people. North Carolinians who did use telehealth shared that it can be really useful in many different situations. For example, you don't have to take as much time off work, don't have to travel to appointments, don't have to worry about childcare for your kids, and can talk with healthcare providers who don't live near you. Overall, it can really help you get the care you need when and how you need it. What does this mean for you? If you're interested in using telehealth services, be sure to ask your healthcare provider about it. You might not be able to use telehealth for all your healthcare, and you may even prefer in-person, but asking your provider is the best way to receive the right information. Everyone should have the opportunity to access the health services they need to be healthy, when and how they need those services. Telehealth can be helpful in making this our reality. Thanks so much. We would like to thank these people and organizations for their support in this project. For more information, please reference our project site, which you can find at the QR code here.